So I'm going to check the doctor's order. So Lucy Maragamo, she has a thigh laceration on her left leg. I'm going to be changing the dressing, and I'm going to be using 4x4 and an abdominal pad and secure with Mafix. But for this purpose, I'll be just using regular tape here. So let's wash my hands. So I have my supplies, 30 ml 30 ml syringe, my Cathalon, which is 18 gauge Cathalon, my tape, my cotton tip, my measuring, as well as my abdominal pad and my sterile kit, and my normal saline and gloves. These are all I need. Now I'll head to the patient's bedside. Okay.
I'm gonna repack. So we're also gonna put our water.
Hello, my name is Jannah Hernandez and I am a student nurse. Prior to entering, I wash my hands, check the environment, making sure it's safe. So before starting, I'm going to verify the patient. I'm just going to check your name band. Lucy Maragamo, birthday February 16, 1997, February 16, 1957. Can you tell me your full name and your birthday? Okay, perfect. Right, patient. So today you will be receiving wound care, which means I'll just be assessing as well as cleaning your wound, your thigh laceration. But before I start, can you tell me what your current pain level is? And do you need any medications? No? Okay. So I'm just going to check and remove the tape for the wound. Left leg. I'm going to put on my gloves.
That. And now we're going to use our push-up to attach that one to the tip of the syringe.
Okay, so here I see there is, for their primary dressing, it's 100% serous sanguineous fluid. Their secondary dressing, which is only 1 4x4, it's also 100% saturated, and it's about 10% to 20% serous sanguineous fluid saturation on the abdominal pad. I will throw this out. Prior to starting, I'm just gonna quickly check the skin around it. Gonna check that. Okay, so I'm just gonna rotate their leg for when I start irrigation. Remove my gloves. Throw that out. Wash my hands. Okay, now I'm going to prepare. My saline, put that there. My tape. This is my syringe. Cathalon, tape, cotton tip, abdominal pad. Perfect. I'm gonna move this. I'm just gonna move this over here. So now I'm going to do this. I'm gonna make sure I mind the 1-inch border. I'm gonna get my forceps. Go. I'm gonna get this. This is just an extra sterile field, but I don't need that, so I'll just be leaving it here. Now I need the garbage. Let's hook it to my hand. Right here. Okay, I'm gonna get my forceps, push it tip to tip, perfect, and my other one, take on this side, push it tip to tip, perfect. Excuse me. Yeah, so now I'm gonna prepare my things. First I'm gonna get my cotton tips, get that. Place that there. The other one here. Perfect. Throw this out. I also need my Cathalon, which is an 18 gauge Cathalon for irrigation.
So now we're gonna.
There you go. Banana peel.
We're gonna
Place this here. Throw both the cap and this out. I'm gonna get my syringe. I'll use my blue forceps. Place that there. Perfect. Throw that out. Now I'm ready. I'm just gonna pour my normal saline in here. Okay, I'm gonna need 30 ml of the normal saline. So now that I got that, oh yeah, yes. Okay, so I'm gonna take this.
I'm gonna take a 2x2.
Okay, perfect. So this will go in the sharps container, but for demo purposes, I will just leave that there. Yeah. Taking this. Here. I'm gonna get that. I'm going to get 30 ml of normal saline. Okay, so since I touched that side, I'm gonna make sure that's within my border. About there. Get my Cathlon. There.
I'm gonna start packing the wound with normal saline. So we're gonna use a 4x4.
That's there. Is that there? I'm going to now start the irrigation. I'm gonna just put gloves on.
Dip it in normal saline.
Okay. So I'm going to start the irrigation process. Take this up there, and I'll be about 5 to 10 centimeters away from the wound. Irrigating it.
Take up excess water.
Entire 30 ml.
And now I'm going to start packing the wound.
Okay, perfect. So I can throw this out. Now I'm going to check for tunneling.
Check in the...
Okay. Perfect. So starting clockwise, 12 for any tunneling.
So next
There's no tunneling. Find that out.
Next, we're gonna, as the doctor said,
I need to now check and measure
the
the length.
We're gonna take a 4x4.
So the length is about 10.5 centimeters. The width is about 3.5 centimeters, and then the depth is about 1.5 centimeters for depth. Okay, throw that out. Okay, now I'm going to clean the skin. I'm gonna make a rosette.
Yeah, okay, we're gonna start that. We're gonna take the
I'm gonna dip it in normal saline. Clean the skin. Drop. The other one.
We can touch the outer part, but not the inner part.
Cleaning it. Wait, throw it out. Now I need another. Now I'm going to dry it. So the rosette. Perfect. Dry it. Last one. Okay. Okay, perfect. Just trying it. And for the ones farther away from the wound, I don't need to use that. I can just use a towel to wipe. Okay, now I'm going to just check for any pooling. So I'm going to get this. I'm just gonna make a hot dog. Hot dog. Hot dog. Gonna do quick. Done. Now I'm going to dip this and actually make my primary dressing. I'm gonna dip it in normal saline. Being careful it doesn't touch me. Okay. Actually, before I start, I'm gonna check the wound. So normal maceration. The edges don't seem to roll, and as well as the peri skin itself is normal, and it's a pinkish color for the actual wound itself. Okay, now I'm going to pack it. Not to touch the outside. Perfect. Okay. So while I'm actually here, I'm just gonna rotate their leg. I'm gonna rotate your leg so that it doesn't fall out. Okay, now I'm gonna get my 4x4. This will be the secondary dressing. Okay. And then another 4x4. Okay, perfect. That's there. I'm gonna take my abdominal pad. I can touch the outside, throw that out, place that here. Take this off. My hands, because I'll be handling tape and it's quite difficult to touch it with gloves. So, let's see, about this long. Okay, another tape. So I'm gonna clean up after that here. So I will throw all of these out, and I will also throw this out because I will no longer need it. Yeah, I'm gonna make sure the patient is at a normal height of the bed. I'm gonna make sure also their call bell is by their side. And then before I leave, I'm gonna do a quick safety check. Okay. I'm also gonna wash my hands before I leave, and then when I'm documenting, I'll be documenting the size of the wound. So it was a 13.5, and then 2.5 and a 1.5 centimeters. So that was the length, width, and depth. And I'm also gonna mention the gauze I removed, which was a 4x4, 100% saturated serisanguinous for primary dressing, and then for secondary dressing it was serisanguinous as well, 100% saturation. And then for the abdominal pad, it was about 10% saturation on the abdominal pad of serisanguinous fluid. The dressing itself, the wound itself had normal odor. There's no signs of infection. It was moist, it didn't seem dry. What else? Yeah, and I'm gonna also mention the amounts of gauzes I packed in. So I used one 4x4 gauze for the primary dressing, two 4x4 gauze for the secondary dressing, and then I also use an abdominal pad, and I use regular tape. And the patient did not take any medications for their pain level. And I'm done.